Welcome back to Medical Videopedia. Causes of hiccups. Hiccups, or hiccups, are involuntary sounds made by spasms of the diaphragm. Hiccups can happen for a lot of reasons. Some of them are physical and some emotional. That's because the actual irritation happens in the nerve connecting to the brain to the diaphragm. The longest bout of hiccups lasted 60 years. Long-term hiccups can indicate there could be something wrong. Some common causes are feeling nervous or excited, drinking carbonated beverages, hot liquids, or too much alcohol, drinking a very hot or cold drink, stress, a sudden change in temperature, swallowing air while sucking on candy or chewing gum, eating too much or too quickly, eating hot or spicy food that irritates the phrenic nerve, which is located near the esophagus, having gas in the stomach that presses against the diaphragm, certain medications, particularly those with anxiety. Medical conditions. Often hiccups occur unexpectedly, and neither the person nor the doctor can identify their likely cause. However, doctors have linked chronic hiccups to several conditions. These include gastrointestinal conditions such as inflammatory bowel disease, a small bowel obstruction, or gastroesophageal reflux disease. Respiratory conditions such as pleurisy of the diaphragm, pneumonia, or asthma. Conditions that affect the central nervous system, such as traumatic brain injury, encephalitis, a brain tumor, or stroke. Conditions that irritate the vagus nerve, such as meningitis, pharyngitis, or goiter. Psychological reactions including grief, excitement, anxiety, stress, and shock. Conditions that affect the metabolism including hyperglycemia, hypoglycemia, and diabetes. Liver and kidney problems. Conditions of the autonomic nervous system, which also affects breathing, sweating, the heartbeat, hiccups, and coughing. Other conditions that may be related to hiccups include bladder irritation, liver cancer, pancreatitis, pregnancy, and hepatitis. Surgical procedures and lesions may also be risk factors. If you enjoyed this video, please like, comment, and subscribe. Please share this video with your friends and family or anyone else you feel like will benefit from this video. If you want to support our work, please consider donating to our Patreon, PayPal, or Venmo. Links are in the description below. Thanks for watching.